Hi, I'm Brooke Cordy. I am Angie's mentor, and I'll be observing her assessment.
Hi there, I'm Angie. I'll be your nurse today. Can you tell me your name and age?
Morgan Hunt, 33 years old.
Nice to meet you, Morgan. Can you tell me what brought you in today?
I've had a headache for a couple of days.
A couple of days. What started when? How did this headache start?
When I was at work.
Okay. Is there anything that you've tried that has made your headache better?
I've tried Tylenol.
Tylenol, okay. And then has anything made your headache worse?
Looking into the light.
Okay. If it's all right with you, I'm going to complete an assessment on you. Perfect. Morgan appears her stated age. She is well groomed. She has a straight posture. Her behavior is appropriate. Her facial expressions match the current situations. Her cognition, she is alert and oriented. She speaks at a appropriate volume and rate. And her thought process, she seems oriented, and it is congruent with her speech. I also observed her gait. She walked in without any assistive devices. It was unlabored, and it seemed natural for her. I'm going to first inspect your skin. I'm going to look all over. Can I look at your hands? Look at your sleeves. Okay. And flip. And look at your legs as well. Her skin color is appropriate for her ethnicity. It is the same all around. I don't see any lesions or any bumps. I'm going to feel the temperature of her skin with the back of my hand. Her skin is dry and warm. There's no moisture. I'm going to feel for skin turgor. Skin turgor is normal. I'm going to check for her cap refill on her fingers on both sides. And I'm going to feel for her pulses on both sides. Okay, Morgan, if it's okay, I'm going to look at your hair. I'm going to inspect and palpate her scalp and hair. It appears normal. I'm going to palpate her neck and her trachea. It is midline. I'm going to listen for the buoys. Okay. I'm going to touch her face if that's alright. I'm going to feel her lymph nodes. Okay. I'm going to feel for her jaw as well. I'm going to inspect and palpate her ears. Okay. I'm going to shine a light into your eyes if that's okay. Okay. Can I have you follow the light? And then can you see this in your peripheral vision?
Yes.
And in your peripheral vision?
Mm-hmm.
Cranial nerves 2, 3, 4, and 6 are intact. I'm going to inspect and palpate your nose and look into your nose. Can you open your mouth for me? Perfect. I looked at her soft and hard palate, her gums, her teeth. I'm also going to take a tongue depressor and stimulate her gag reflex. Okay. Cranial nerves 9 and 10 are intact. And then can you repeat after me? Light, tight, dynamite.
Light, tight, dynamite.
And cranial nerve 12 is intact. I am going to listen to your lungs if that's okay.
Mm-hmm.
I'm going to start with the back side. And I'm going to listen to the front side as well. And listen to your heart. And listen to your belly. I've observed her breathing pattern. It was normal. I listened to all lobes of her lungs, anteriorly and posteriorly. I listened to her heart sounds. I heard S1 and S2 with a regular rhythm. And I listened to all quadrants of her abdomen as well. I'm now going to palpate. And I'm going to inspect it as well, if that's okay.
Really?
Okay, inspect and palpate. It looks great. Before I move on to your extremities, Morgan, if you could close your eyes for me 1 second. And can you identify the smell that you are smelling? Alcohol. Correct. Cranial nerve 1 is intact. I am now going to observe her range of motion and her strength in her upper extremities. Can I hold your hands? Can you squeeze them for me? Can you push against resistance and push against resistance? Can you lift your hands above your head and go down and then in and out as well? With your feet, can you push against my hands? Can you push against my hands again? And then can you lift your legs up and down? And then could you move them side to side as well? Okay, I've observed her range of motion. If it's alright, Morgan, can I take your shoes and socks off? Okay. Alrighty. I'm checking her pedal pulses bilaterally and her cap refill, and I've observed no swelling or edema. And I believe that I've checked everything. Do you have any further concerns for me?
No issues.
Okay, thank you for your time, Morgan.
You're so welcome.